My experience has been great. I honestly really like the structure of it.
It's great. I love everyone here.
I feel like it's just a big community.
Our DPT curriculum is unique. The curriculum is definitely integrated from day one.
When you think about how does a student learn best, how does anyone learn best? They learn by doing, taking the knowledge and the information and then applying it.
As a physical therapist, the two most important tools in your toolbox are your hands. And here at the University of St. Augustine, we want our students to learn therapeutic touch and therapeutic use of hands starting in the first term.
They'll practice with each other initially, and as they get checked off on those skills, they are approved then to move into certain simulations. And as they go through these simulations, they're put into a mock case where they're working alongside a standardized patient, somebody who is working off of a script, trying to mimic what it would be like to be in clinical practice. Once they've checked off their ability to go through the simulation, we engage them in our pro bono clinical experiences.
Every day we come in here, we're learning how to do things with our hands. We're learning how to communicate with our patients, all aspects of being a physical therapist.
Professors will walk around. That way if you have questions, you can ask them, or they'll correct you on the spot and like, oh, you should try this instead.
We have enough faculty that we can work around the room and give individual feedback to each person.
The faculty is great.
Majority of the faculty that teach in our physical therapy programs still provide patient care. They each bring a unique piece of the profession of physical therapy to the classroom.
Like, you can really tell that they genuinely do care.
So having that hands-on experience with our professors giving their clinical experience and input is very helpful.
Innovation at USAHS is deeply tied to our DNA. We want students to be able to come into a learning space where they're exposed to state-of-the-art technologies, both in the teaching and learning experience, but also technologies that prepare them for practice.
It's very nice to have like this higher level technology because you can really look at it, touch it, feel it.
So they can review their simulation encounters and hone their skills, things like motion analysis or augmented reality, virtual reality, telehealth.
Our entry-level program has electives included in the program. The electives have been designed for students either to take a track of electives or to be able to sample different aspects of physical therapy.
Sports therapy, manual therapy, business leadership, pelvic health, neuro. Oftentimes, those are not taught in a DPT curriculum. We're different here.
So I'm really glad that they have some options for us to choose from while we're still in school, so we know how many different options we have out there in the clinic.
The opportunity to do that before you even graduate, I think is incredible.
They are ready day one of fieldwork. They're prepared, they're confident, they really excel because we've trained them well.
I truly believe that our professors are setting us up for success.
I would highly recommend the program.